All right. Hello, everyone. Welcome in. Welcome to Lab 6 of Anatomy. Lab 6, we're going to start going over our lower extremity muscles. You know that last week we actually went over our upper extremity muscles. We were able to go over some scapular stabilizers, also our glenohumeral muscles and some brachial muscles as well, learning that origin, insertion, and action of those muscles. So today we're actually going to finish the rest of your upper extremity muscles, go into your forearm muscles. We have your anterior and posterior forearm muscles, and then we will dive into our leg muscles. But before we get started, like I said last class, we are going to start every class off with the Kahoot just to test you guys' knowledge from the previous week. Make sure you guys are staying on track with your studying skills and whatnot. So to start, let's do that. Okay, so on you guys' end, I encourage you guys to pause the video when the question pops up to give you guys time to think through the question, see if you guys know the answer to it, and then replay the video and see if you got the right answer. Right. What is a key feature of scapular stabilizer muscles? Pause the video here, select your answer on your end, what answer you choose, and then replay the video when you have a correct answer. Try not to look at your notes when you're doing this. Try to just use your knowledge. So the correct answer is the insert on the scapula. All your scapular stabilizer muscles will insert on the scapula. That will produce your scapular motions, which include your retraction, your protraction, your elevation, depression. All these muscles are a part of your rotator cuff muscles except what? Pause video here and select your answer. You selected teres major. You are correct. You have your rotator cuff muscles, your sits muscles. Your sits muscles are going to include your supraspinatus, your infraspinatus, teres minor, and your subscapularis. The insertion of a muscle is the most mobile and moves toward their stable origins. True or false? Pause the video here and select your correct answer. The answer is true. Remember that the insertion of a muscle is always going to be your more mobile attachment for a muscle, and that's going to move towards your stable origin. Coracobrachialis produces elbow flexion. True or false? Pause video here and select your answer. The answer is false. Remember, in order to produce action at the elbow joints, that muscle has to cross the elbow joint, which means it's going to have to insert onto either your forearm muscles or below your forearm bones, which are your ulna and your radius. Because your coracobrachialis does not pass that elbow joint, does not insert on your ulna or your radius, it will not produce any elbow flexion. The serratus anterior insert on the anterior scapula or posterior. Pause your video here and select your answer. Correct answer is anterior. Right in the word serratus anterior, it's going to insert onto the anterior border, anterior medial border of the scapula. All glenohumeral muscles originate from the humerus. True or false? Pause your video here and select your correct answer. Answer is false. All your glenohumeral muscles will insert onto the humerus, not originate from the humerus. Just like your scapular stabilizer muscles, they will all insert onto the scapula, not originate from the scapula. How many heads does tricep brachii have, and what are they called? Pause your video here, select your answer. 3. You tricep brachii, remember tri meaning 3. You're going to have 3 heads, and they're going to be the long head, lateral head, and your medial head. True or false? The rhomboids, major and minor, insert on the thoracic vertebrae. Pause your video here, select your answer. The answer is false. Remember, they originate on the thoracic vertebrae. Your insertion is going to be your more mobile. So your rhomboids are going to insert onto that medial border of the scapula because that's going to be your more mobile. That's going to produce your scapular retraction. When that insertion or that medial border is going to move towards that thoracic vertebrae, you're going to get scapular retraction. What is the action of the middle trapezius? Pause your video, select your answer. Correct answer is retraction. Remember, your middle trap, you're going to have that origin of that thoracic vertebrae, insertion on the scapula. When that pulls, you're going to get that retraction. A common insertion for teres major and minor is the greater tubercle of the humerus. True or false? Pause your video, select your answer. False. The greater tubercle will not be a common insertion for your teres major and minor. Remember, your teres major is not part of your sits muscles. You have your supraspinatus, infraspinatus, and teres minor. Those 3 are going to insert onto the greater tubercle. Teres major will not. What action does the latissimus dorsi muscle produce? Pause your video and select your answer. If you selected either extension or adduction, you are correct. Remember, latissimus dorsi is going to come from that posterior aspect of your back. It's going to wrap around and insert onto that intertubercular groove of that humerus, and that's going to pull into extension, adduction, and internal rotation. Infraspinatus produces shoulder external rotation. True or false? Pause your video and select your answer. The answer is true. Infraspinatus is going to come from the infraspinous fossa, insert onto that greater tubercle of the humerus, is going to pull from its more mobile inserts to its more stable origin. It's going to pull that humerus into external rotation. What is the origin for the short head of biceps brachii? Pause your video and select your answer. Your coracoid process will be the origin for your short heads. Remember, bi meaning 2, you're going to have 2 heads, your short head and your long head. Short head is going to originate from that coracoid process. Your long head is going to originate from that superior glenoid cavity. Insertion for pectoralis major. Pause your video, select your answer. Your intertubercular groove or sulcus will be the insertion for your pec major. Remember, your pec major is going to originate from that clavicle, that sternum, and your ribs is going to come all the way across and insert into that groove in between your greater and lesser tubercle, right there. Last one. The primary agonist for shoulder flexion is the anterior deltoid. Pause your video, select your answer. Answer is true. Remember, shoulder flexion, it has to cross that shoulder joint, has to insert somewhere in that humerus. Your deltoid is going to, the anterior deltoid is going to originate from that clavicle, insert onto that deltoid tuberosity of the humerus, and pull upwards into shoulder flexion. Good job. That's okay. So if you guys did good on that. You guys are on the right track. If you guys had a little bit of trouble with it, that's just a reinforcement of you guys to hone in your studying. Remember, you're going to need to know the action, insertion, and origin of these muscles. So definitely, remember I said last class to group these muscles. You have your scapular stabilizer, you have your glenohumeral muscles, you have your rotator cuff muscles. Try to group them to make it more easier to understand and to learn instead of just trying to memorize the entire chart that we did. So like I said, we are going to move into we're going to start the muscles of our forearm. So we have our anterior forearm and we're going to have our posterior forearm. Some key things. Sorry, didn't realize my face was down there. See. All right, so your anterior forearm muscles. You're going to have a flexor pronator group. You're going to have your pronator teres, flexor carpi ulnaris, your flexor carpi radialis, palmaris longus, and your flexor digitorum superficialis. As you see here, common origin is going to be that medial epicondyle, which means all of these muscles here, 1, 2, 3, 4, and 5. The origin for all 5 of those muscles are going to be your medial epicondyle. Now, if you guys remember where your medial epicondyle is, you guys should be able to understand what I'm about to tell you. One easy thing to remember, we have pass, fail, pass, fail. Okay? You're going to put your thumb onto your medial epicondyle here, and your pointer finger is going to be pass, middle finger, fail, ring finger, pass, pinky finger, fail. Just like that, sprawled out onto your forearm. Pass, fail, fail. Okay? Now, when we talk about pass, fail, we have pronator teres is going to be your first pass. Remember, we have pass, fail, pass, fail. So you have your pronator teres. Going to be your first pass. That's going to produce, in the word, pronation. Pronator is going to produce pronation of that forearm. Okay? Fail. That ring finger is going towards that your thumb, towards your radial side. So from here, pass, fail. My middle finger, excuse me, my middle finger is going towards that thumb side, that radial side, which means your fail is going to be, your first F is going to be your flexor carpi radialis, because we're going to that thumb side. Remember, your radius is going to be your thumb side, ulna is going to be on your pinky side. So your flexor carpi radialis. And we have pass again. Pass is going to be right in that middle. You're going to be using your ring finger. That's going to be your palmaris longus, your PL. Palmaris longus is going to be that ring finger when you're like this, sprawled out. And then lastly, our second F, we're going to have, I just realized I said fast. Fail, excuse me. Then we're going to have fail again. That's going to be your flexor carpi ulnaris, using your pinky finger when you're sprawling out. Pass, fail, pass, fail. Pinky finger, we're going towards that pinky side. So that's going to be your flexor carpi ulnaris, towards that pinky side. Okay? Underneath those four, right underneath it is where you're going to find your flexor digitorum superficialis. You come here. See about this bookmark. Okay. These are going to be all of your anterior flexor muscles. So like I said, that pass fail. This is our medial epicondyle here. We have pass, our pronator teres there. We have fail, flexor carpi radialis going towards that thumb here, there. We have pass again, palmaris longus right in the middle. It goes, and you see it goes into your palm, that fascia. And then you're going to have F again, you're going to have fail again, flexor carpi ulnaris going to that pinky side, that ulnar side. Right underneath those is your flexor digitorum superficialis. So if I was to hide these, it is still coming from that medial epicondyle, but it's going to be underneath, and it goes to your digits. Okay. But before we go any further, I'm going to give you guys some key things. Okay. The word flexor, here, here, and here. Flexor is going to be on your anterior forearm muscle. So we have your anterior forearm muscle. That means it's going to be on that anterior side when we're standing in anton position. It's going to be on that anterior forearm. The word carpi. Carpi means wrist. So it's going to be an anterior forearm muscle that crosses the wrist. If it crosses the wrist, that means you're going to have some wrist movements. You're going to have flexion extension, ulnar deviation, or radial deviation. And then lastly, like I said, ulnaris and radialis. Ulnaris meaning towards your ulnar side, radialis to your radial side. So ulnaris will mean pinky side or your ulnar side, and then your radialis will mean your thumb side. This is going to be like a cheat code for these muscles. All your flexor pronator group muscles is going to be a cheat code just like this. Your flexor, the word flexor means the anterior forearm muscle. The word carpi means wrist, ulnaris, pinky side, radialis, thumb side. So when we're talking about flexor carpi ulnaris, is how you know it's going to be a anterior forearm that crosses the wrist and goes towards that pinky side. We have anterior forearm, crosses the wrist down here, crosses this joint, and then goes to that pinky side. So flexor carpi ulnaris, crosses the wrist, goes to that pinky side. Flexor carpi radialis, crosses the wrist, goes to that thumb side. Now, pronator teres, pronator equals pronation. It's just going to perform pronation. And if your palmaris longus has no action, your flexor digitorum superficialis. Flexor, like I said, is going to be anterior forearm muscle. Digitorum means digits. Your digits are going to be 2 through 5. It will not hit your thumb muscle, your thumb digit. Your digits are only digits 2 through 5. And then superficialis, something that's superficial is more towards the surface, while deep is going to be down below. Like I said, the origin for these muscles are going to be here at medial epicondyle. The pronator teres, our first pass, is going to insert onto that radius here. When that pulls upward, you can see how this is going to come around into pronation. Okay. Origin, flexor carpi radialis. Insertion is going to be down here. That's going to pull up, which means you're going to get some wrist flexion. But also because we're pulling in like a slightly slanted manner, we're also going to get radial deviation. If this pulls this way, you can imagine our hand is going to move to our radial side. So we're going to get wrist flexion, and we're also going to get radial deviation towards that thumb side. Our flexor carpi ulnaris originates from that medial condyle, inserts down here, and that pinky is going to come upwards. You're going to also get that wrist flexion, but also since it's on the pinky side, it's going to pull your hand inward more immediately, which is called ulnar deviation. So your flexor carpi ulnaris is going to get wrist flexion and ulnar deviation. Underneath your flexor digitorum superficialis, you can see how that's only sprawling into digits 2, 3, 4, and 5. Flexor digitorum superficialis is going to flex your digits. Flex digits of 2 through 5. See your pronator teres there. Origin, your medial epicondyle. Insertion is going to be on that radius, and you're going to perform that pronation. Wrist flexors. Try to fill this out on your own. If you want, pause the video and use context clues to figure out which one's which. Remember where your flexor carpi ulnaris is going, where your flexor carpi radialis is going, maybe. Your flexor digitorum superficialis, where is that going? Using those keywords. Pause the video here and try to figure that out. You come back, and we have your pass, fail, which means this will be your flexor carpi radialis going towards that thumb side. We have our palmaris longus, because you see it's going into that palm. We have your flexor carpi ulnaris going to that pinky side here. And then underneath those four, under your pass fail, directly underneath is where you're going to have your flexor digitorum superficialis. Yeah, flexor carpi radialis, palmaris longus, flexor carpi ulnaris, and flexor digitorum superficialis. Okay. Let's go to our packets. Actually, let's go over our posterior forearm real quick first, and then we'll go to the packet. So our posterior forearm, that's going to be your extensor supinator group. You're going to have your supinator, just like in a flexor pronator group, we had our pronator teres. So you're going to have our supinator, you're going to have our extensor carpi ulnaris, our extensor carpi radialis longus, extensor carpi radialis brevis, and your extensor digitorum. Common origin for this one is going to be your lateral epicondyle. So our common origin for our flexor pronator group was our medial epicondyle. Now on the posterior side of our forearm, we're looking at our lateral epicondyle for our common origin. Let's see what time we have. Okay, so just like I gave you guys a little cheat sheet there, we're going to have extensor is going to mean your posterior forearm muscle. So our flexor is going to be our anterior forearm muscles. The word extensor means you're going to find that muscle in the posterior forearm. So our extensor is going to be our posterior forearm muscle. You're going to have carpi again. Carpi here, here, and here equals the wrist. That means it's going to cross the wrist. So we're looking at a posterior forearm muscle that crosses the wrist. If a muscle crosses the wrist, it's going to perform our wrist movements, which are our flexion, extension, ulnar deviation, radial deviation. Radialis and ulnaris. You're going to have, ulnaris pinky side, and then radialis thumb side. Now, longus and brevis. The word longus, like in the word, is going to be long, and the word brevis is going to be like brief. It's going to be short. So you're going to have a muscle supinator. Supinator is going like when you're in supination, it's like you're holding the soup. So our supinator is going to bring our forearm from pronation back to supination. Our extensor carpi ulnaris is going to be a posterior forearm muscle that crosses the wrist and goes towards our pinky. You're going to have our extensor carpi radialis longus. You're going to have extensor, a posterior forearm muscle that crosses the wrist, goes towards our thumb side, but it's long. And you're going to have one that is shorter. Then our extensor digitorum, posterior forearm muscle for extensor. The word digitorum means digits 2 through 5. Star that, key that. Make sure you guys are understanding those keywords. Now, we come here. Posterior forearm muscles. You see now we're on that lateral epicondyle of the humerus. Instead of on the anterior side, we're on that medial epicondyle. So now we're in the lateral epicondyle. From the lateral aspect first, this muscle here, without looking, try to figure out and use key context clues. Use the little cheat sheet that I gave you guys. Try to figure out what muscle this muscle right here would be called. It's going to originate from that lateral epicondyle. It's going crossing the wrist and going on a certain pathway. We pause that there. Okay. This is going to be your flexor carpi radialis longus. So you're going to have, extensor carpi radialis longus. So like I said, extensor is going to be your posterior forearm muscle. Carpi crosses the wrist. Radialis on that radial side, that thumb side. And longus is going to insert on that second metacarpal. It's going to be a longer muscle. So if I isolate that, that's what it looks like. Now, right next to it, you're going to see extensor carpi radialis brevis. If I isolate that, you see how this one is a little bit smaller than longus. And it's also inserting onto that third metacarpal, not the second metacarpal. This one here, you guys can see how this is going, sprawling out to digits 2, 3, 4, and 5, which means it is going to be your extensor digitorum right there, because we're going to the digits of the hand. Now, oh, snap. Hold on. Now on this end, we are coming down, crossing the wrist, and going to our pinky side. Extensor, posterior forearm muscle, carpi, cross the wrist, pinky side ulnaris. Extensor carpi ulnaris, right there. Okay, now, not me to do that. Right here. All right, supinator is going to be our supinator, right underneath all those four muscles. So we went over extensor carpi ulnaris, radialis longus, radialis brevis, where radialis longus is going to insert onto that second metacarpal, and then brevis is going to insert onto that third metacarpal. Right here, origin for your supinator is going to be that lateral epicondyle. Insertion is also going to be that radius. So just like your pronator teres inserted onto that radius, your supinator is also going to insert on the radius. It's just going to originate from the lateral epicondyle instead of the medial epicondyle. Action, in the word supinator, we have supination. And take some time to figure out which one are these. Pause video if you can, and try to point out which one's which using that little grid. Extensor, posterior forearm muscle, carpi across the wrist, etc. See over here, we have your extensor carpi radialis longus and your extensor carpi radialis brevis. How do we know that? Because see the insertion, one is on that second metacarpal, and another one is on that third metacarpal. Here we have your extensor carpi ulnaris going to that ulnar side. And then here we have your extensor digitorum going to those digits. And that's what you see here. So just like our flexor pronator group, extensor carpi ulnaris, if it's going to come from that posterior aspect, the posterior forearm, and cross the wrist, that means when it pulls from crossing the wrist, if it pulls upwards and it's going to pull towards its origin at that lateral epicondyle, here we go, extensor, jeez. We have our brachioradialis there, kind of coming a little bit more anteriorly, one of our brachial muscles. Supposed to hide that. And we have your extensor carpi radialis longus. If our origin is here and insertion is down there, insertion moves towards our stable origin, so we're going to pull upwards. We're on that posterior end, so we're going to pull upwards, which means you're going to extend that wrist. So I'm sitting here like this, it's going to extend that wrist. Sure if you guys can see that, but that wrist is going to extend back. But also because we're on that radial side, you're going to get some pull this way as well, which means you're also going to get some radial deviation. So we're extending the wrist and we're doing a little bit of radial deviation. Same with our extensor carpi radialis brevis. Our extensor digitorum is going to, or digitorum means digits, is going to extend our digits 2 through 5. 1, 2, 2, 3, 4, and 5. Now over here, we're going to have our extensor carpi ulnaris. That origins at that lateral epicondyle. Insertion is on that pinky metacarpal. We're going to pull upwards towards our more stable origin. We're going to get that extension of the wrist, and we're also going to get some ulnar deviation moving towards the pinky. You guys can see that there. So our extensor carpi ulnaris, we're going to have some extension and ulnar deviation. These two are going to have extension and radial deviation. Hope everybody's good with those. Let's go to your packets now. I want you guys to take a couple minutes to try to fill this out on your own. I know I just gave you guys the actions, but try to understand how we're getting these actions. So take a couple minutes, pause the video, and then come back in a couple minutes when you're done. Okay, now that we're back, after filling out that on your own, try to understand these actions. So, like I said, it's going to be pronator teres. That pronator teres. What is a common insertion? Common origin first. Common origin for all your anterior forearm muscles, your anterior antebrachial muscles. Common origin should be that medial epicondyle. Remember, we're doing pass, fail, pass, fail. So we have pass. Remember, our first fail is going to be our radialis one. So pass, fail, and then we're going to have pass, fail. Because we're out like this. Pointer finger, pronator teres, middle finger, flexor carpi radialis going to that thumb side. Ring finger, palmaris longus, pinky finger, flexor carpi ulnaris to the pinky side. So these actions, pronator teres, we're going to have pronation. Right in the word. Our flexor carpi ulnaris. What does flexor mean? Anterior forearm muscle. What does carpi mean? Crosses the wrist. What does ulnaris mean? It means we're going towards that pinky side. So if that muscle contracts and goes and is contracting towards its stable origin, towards its medial epicondyle, you should be getting some wrist flexion and ulnar deviation. Now, when it comes to these muscles, you guys are going to have to be specific about what is it flexing. So you cannot just say it produces flexion. It could be elbow flexion, it could be shoulder flexion. You guys have to be specific and say flexor carpi ulnaris is going to produce wrist flexion versus our biceps brachii is going to produce elbow flexion. So please be specific when it comes to the exam for these ones. Palmaris longus. Also going to have some wrist flexion. So it's going to be forearm pronation. Flexor carpi radialis, we're going to have wrist flexion and radial deviation. And your flexor superficialis, we're going to flex your digits. Flexion of your digits. And we're talking posterior. What is the common origin for our posterior forearm muscles? The common origin should be our lateral epicondyle. Remember, the word extensor is going to mean posterior forearm muscle, carpi, across the wrist, ulnaris, we're going to that pinky side, radialis to that thumb side. Supinator in the word, you guys should have gotten supination. Your extensor carpi ulnaris, you guys should have gotten wrist extension and ulnar deviation. For flexor carpi radialis longus and brevis, you guys should have gotten some wrist extension and radial deviation. That's for both. And then just like our flexor digitorum superficialis, we're going to have our extensor digitorum, which is going to extend our digits. Extension of our digits. So these insertions, just like you see here, you're not responsible for specific insertions. Anything that says think pinky side, think palm side, you're not responsible for knowing those exact insertions for these muscles, but definitely know the actions for these muscles as well as our common origins. Okay. Going to, let's see. We're going to share here. Identify the muscle marked by the arrow. So pause your video, try to figure out what muscle this is, and then come back for the answer when you have a solid answer. You guessed extensor carpi ulnaris, you are correct. You guys know that we're on that posterior aspect because we're looking at the dorsal side of our hand. So we're going to be looking at our extensor group, our posterior forearm muscles. Extensor group here, you see how this muscle is following, all the way to that pinky side. So you know we're going to have some ulnaris in there, and it's going to cross the wrist. So extensor carpi ulnaris. Match the phrase with the correct response. So pause your video here. Try to see if you guys can match the phrase with the correct responses, and then come back for the answer when you have completed that. So once you guys are done, I should have gotten that on the anterior forearm. You're going to have your flexor pronator group. Remember, the word flexor is going to be your anterior forearm muscles. Found in the posterior forearm is going to be your extensor supinator group. You're going to have your extensors found in that posterior forearm. Origin of your medial epicondyle is going to be your flexor pronator group. And then your lateral epicondyle is going to be the origin for your extensor supinator group. Identify the action occurring at the wrist joint of the basketball player. So like I said, you guys are going to have to hone in on your clinical-based question instead of just question answer. So you might see a question similar to like this on the exam. So use your pause video here and try to rule out what muscle is going to, what actions are occurring at this wrist. Excuse me. Now, if you said wrist flexion, you are correct. You see how this will be his anterior forearm. If you're shooting a basketball, this is our anterior forearm. You're shooting a basketball, we're going towards our anterior forearm. Our flexor muscles, excuse me, are going to be on our anterior forearm and are going to pull up into wrist flexion. Do one more, identify two actions of the muscle marked by the arrow. Pause video here, try to answer this question. So, two actions of the muscle. This muscle, if you guys are looking, We're on that anterior side, which means it's going to be a flexor pronator group muscle. We have our pass, fail, pass, fail, pass, fail, pass, fail, which means this is going to be, this muscle is going to be our flexor carpi radialis. Pass right there is going to be our pronator teres. Fail, flexor carpi radialis, going to that thumb side, which means we're going to get some wrist flexion and some radial deviation. Okay. Let's move on. Did we finish up? I would encourage you guys to fill this out after as like a review. So after you guys are done watching the lecture, I encourage you guys to come back here and fill this out as your review. See if you guys understand it. Now, moving on to lab 6, our lower extremity muscles. We're going to have muscles of the hip and thigh to start off. So, as you can see here, in general, you're going to have any muscle that is going to be on your anterior hip, as going to be an anterior hip muscle, is going to produce hip flexion. Any muscle that's going to be on your anterior knee muscle, a muscle that's going to cross that knee joint on that anterior side, is going to produce knee extension. Okay? So we have our anterior muscle, we have our iliopsoas, our sartorius, and our quadriceps femoris. This is just going to be our quad muscles. So our iliopsoas. Origin is going to be on that vertebral column here, and our iliac fossa. So we know that this is our iliac. We know that this is our iliac crest. On that anterior side of that ilium is going to be our iliac fossa, right in there. Those are going to be your two origins. Our insertion is going to be bony landmark of our femur, right here. So we have this bony landmark, which is called, you guys should be saying, the greater trochanter, not tubercle, which means we're going to have another bony landmark here, which is going to be your lesser trochanter of the femur. So that muscle is going to insert onto that lesser trochanter of the femur. As you guys can see, these muscles are crossing this hip joint. They are coming down and they're crossing that hip joint. If it crosses the hip joint, which that means we're going to have hip movements. Hip movements are going to include your flexion, hip extension, your hip adduction, abduction, internal, external rotation. Why? Because there's going to be a ball and socket joint that's going to move in all three planes. So like I said, we're going to have our anterior hip muscles are going to produce hip flexion. These muscles are on the anterior side. They are crossing that hip joint, which is how you're going to get hip flexion. If I bring up here. And so our iliopsoas group, these two there. If we're originating from here and here, is our origin, and our insertion is going to be on that lesser trochanter. If we are pulling up towards our more stable origin, you can imagine that this femur is going to move higher up, is going to come into hip flexion. You are bringing your leg up like you're doing marches. So hip flexion is like doing a march. Those are working your iliopsoas. So origin here, insertion is down here. If I'm pulling upwards, I'm going to get that hip flexion. Our sartorius. This is going to be known as your figure four muscle. Why is it known as your figure four muscle? I mean, it's a backwards figure four there, but that's going to be your figure four muscle. Because we are going to produce three actions here: hip flexion, external hip rotation, and knee flexion. I see that origin is going to be on that ASIS. And then we have four iliac spines. We have our anterior superior, our anterior inferior, and our posterior superior, and our posterior inferior. Sartorius is going to originate from that anterior superior iliac spine, and it's going to insert onto that tibia right there, but more on that medial side of the tibia. So instead of inserting right on that tibial tuberosity right in the middle, we are inserting on that medial side. Hip flexion, you guys can see here how that femur is coming up. We're doing a march kind of. External hip rotation, we are turning outwards, which is how we get this little slant outwards. And then knee flexion. Now, I know you guys may be wondering, I thought you said that the anterior knee muscles are going to produce knee extension. I did. But for this case, our sartorius, you can see we have the origin at that ASIS there, insertion on that medial side of the tibia. Because it is on the medial side, that is why when this pulls upwards, you are going to get a kickback. You're going to get knee flexion. You bring your knees, you bring your heel to your butt. You're going to get knee flexion instead of knee extension. Now, if I have a muscle that was to originate from there and inserts here, right on that tibial tuberosity and pull upwards, then I would get knee extension. But because our sartorius, kind of making like a S shape, is going to insert onto that medial side of the tibia, when that pulls upward, that's how we're going to get knee flexion, hip flexion, and some external rotation. There, I see that. That's going to be our sartorius. On our model, our big S shape muscle right here is going to come from the ASIS, come all the way down, insert onto that medial tibia. Now, our quads groups, we're going to have four muscles that are going to be in our quads. We're going to have our rectus femoris, our vastus lateralis, which means lateralis going to be more on that lateral side, vastus intermedialis more in the middle, and vastus medialis more on that medial side. One common thing here, all of those muscles are going to insert onto that tibial tuberosity, which is going to be that anterior portion of the tibia. That little bump that you're going to feel on your tibia, around the anterior side, you guys can palpate it yourselves. Actually, you guys come from your patella and you move straight down onto that tibia. You guys are going to run into a bump on your tibia. That's going to be your tibial tuberosity. So, your rectus femoris, that's going to be your biggest muscle. The only quadriceps muscle is going to cross the hip. If it crosses the hip, that means you're going to get some hip movement. Because it crosses the hip, we're going to originate from that AIIS. So we have our sartorius originate from that ASIS, anterior superior iliac spine, but we have our rectus femoris originate from that AIS. Rectus femoris there. You guys can see how it is coming from this spine there, our AIIS, and it's going to insert on our tibial tuberosity. It's going to come down with a, let me see, the patellar ligament. So if you guys remember, we are going to have our quadriceps tendon that's going to connect the quad muscle to our patella, and our patellar ligament connecting the patella to the tibia. That's how we're going to get that there, where that quad muscle is going to insert onto that tibial tuberosity from that connection. So like I said, we're going to have origin AIS insertion on that tibial tuberosity. Insertion is going to move towards our stable origin. We're going to get knee extension. We're pulling that knee outward. We're kicking a soccer ball. We're getting knee extension. But then because we are on the hip bone, we're on our coxa bone, we are going to, and we're crossing this hip joint here, we're going to get some hip movements. Now, because we're pulling upwards, we're also going to get movement of the femur moving up. We're also going to get some marches going on. That's going to be our hip flexion. So that's how our rectus femoris is going to get our hip flexion and our knee extension. Vastus, we're going to have vastus lateralis, medialis, and intermedialis. You see here, this is going to be our rectus femoris, big muscle in the middle. On your muscle, here's your sartorius here, coming down. Here's your rectus femoris, right in the middle. You have your rectus femoris in the middle. And then on either sides, we know that this is going to be our lateral side. This would be our medial side. So that's how we're going to get our vastus lateralis there. That's going to originate on that greater trochanter of the femur. We're going to get our vastus intermedialis. Now, our vastus intermedialis is going to be found underneath our rectus femoris. So we're going to have to pull that rectus femoris back in order to find it. And then we're going to have our vastus medialis on that medial side. Intermedialis originate from the shaft of the femur on the anterior side, shaft of the femur on the medial side for medialis. There you guys on central anatomy. Trying to look up quad muscles to make it easier, but I guess not. Now, rectus femoris, we have our vastus intermedius, vastus lateralis, and our vastus medialis. You can see that there. Rectus femoris here on the medial side, our vastus medialis, vastus lateralis on our lateral side. If I was to fade that, there's our vastus intermedialis there. Vastus intermedialis right there. Now, like I said, rectus femoris, as you guys can see, if I bring our rectus femoris back, it is the only muscle that is going to touch our hip bone, the only muscle that's going to cross that hip joint, only quad muscle that's going to do that. You see our medialis, lateralis, medialis, and our intermedialis are all going to insert onto somewhere on that femur, which means we're not crossing the hip joint, which means we're not producing any hip movements. The vastus rectus femoris is the only quad muscle that's going to produce hip movements. So with the other three, we are only going to get knee extension because Our common insertion for all these quad muscles are going to be our tibial tuberosity, which is on that anterior side there. So when that pulls, we're going to get knee extension. We're going to be kicking the ball, kicking the soccer ball. Okay. Now, muscles of the hip and thigh. We're going to have our medial muscles. In general, our medial hip muscles are going to produce adduction. Adduction. So we have our anterior hip muscles that are going to produce hip flexion. We have our anterior knee muscles that are going to produce knee extension. Now we have our medial hip muscles that are going to produce adduction. These medial hip muscles are going to be considered your adductors because they produce adduction. Pretty simple, right? We're going to have three. You're going to have a brevis. Brevis, as we know from our extensor carpi radialis, brevis and longus. We're going to have brevis, one that is shorter or smaller. We're going to have a longus, one that's longer. And magnus, something that's magnus, big magnitude, is something that's going to be big. And we're also going to have our gracilis. Our adductor brevis. If we're moving from superior to inferior in this picture, we're going to have brevis, longus, magnus. So adductor brevis is going to originate on that pubis. One common origin for these adductors are going to be the pubis. You see adductor brevis is going to be the pubis, adductor longus, our pubis, adductor magnus, pubis as well. So like I said, try to group these muscles into common insertions, common origins, common actions. So origin is going to be our pubis. Insertion is going to be that linea aspera. You guys remember linea aspera is going to be that line, that kind of crest line that's going to be on our femur. And that's going to produce hip adduction because all of our adductors are going to produce hip adduction, adduction. Adductor longus, you see how this one is longer than our brevis here. Adductor longus, also going to insert on that linea aspera and also going to produce hip adduction. So we have everything in common about these. Adductor magnus here. You see more of it on that posterior aspect. So this is going to be a posterior view. This is an anterior view. You can see more of that adductor magnus on that posterior side. See how big it is? That's why it's considered adductor magnus, because it is so big. That's also still going to originate from that pubis and insert onto that linea aspera, also producing hip adduction. So you guys see with all three of these adductors, our common things that we got of it is origin is going to be pubis, insertion, linea aspera, and action is going to be our hip adduction, adduction. All three of those adductor muscles are going to have the same content. So group them together makes it a lot easier. Our gracilis, also going to originate on that pubis. Another one, right here. But instead of inserting on the linea aspera, it is going to insert on that tibia, down here on that medial side of the tibia. So just like the sartorius inserted on the medial side of the tibia, we're going to get some knee movements. If we are crossing the hip joint, we're attaching onto the hip bone, we're going to get hip movements. That's where we're going to get our hip adduction because our gracilis is considered an adductor muscle. At the same time, just like our sartorius inserted onto that medial tibia, When that pulls upward, we're going to get a backwards kick. We're going to get our heels to our butt, which means we're also getting knee extension. So that's the only knee flexion, knee flexion. That's the only difference. So your gracilis and your sartorius are going to insert onto that medial side of the tibia. When that pulls, you're going to get that knee flexion. We're going to bring our heel to our butt. And just like the rest of the adductor muscle, we're going to get hip adduction. I know this is kind of hard for me to show on the model through Zoom. So if after you guys are finished watching this lecture, you guys are more than happy to, I encourage you guys to meet with me. And I will bring the models so that way you guys will be able to see it on the models that you guys will be tested on. Okay, let me show you guys that. Don't have that to bookmark. Yeah, our adductor brevis there, our adductor longus there, and then our adductor magnus there. So you guys can see if we're looking on that medial view, this would be our longus there. You'll see our magnus there. Brevis is going to be really tiny right there. Brevis is kind of, you won't be able to see brevis because you kind of have to remove some muscles. But brevis, that is where it'll be located. And you see magnus, how big it is. They're all inserting on that linea aspera and originated from that pubis here. Okay. Actually, pull up some top hat questions. Muscles that cross the anterior side of the hip perform hip blank, while muscles that cross the posterior hip perform hip blank. Pause your video here and see if you guys can get the correct answer. You guys should have gotten flexion and extension. So if we're on that anterior side of the hip, that means we are performing hip flexion. We are pulling upwards. We're doing high knees. Muscles that cross the posterior hip, on the posterior side, is going to do hip extension. Muscles that cross the anterior side of the knee perform knee blank. Pause the video here and write down your answer. You guys should have gotten knee extension. We are kicking a soccer ball. We are extending that knee because we're crossing the anterior side. We are on the anterior side, crossing that hip joint. We're producing some knee movements. We are pulling up our knee into knee extension. Identify the insertion of the muscle marked below. Pause your video here and try to complete the question. You guys should have known that this is one of our quad muscles. We're on that medial side So this will be our vastus medialis. And our insertion for that muscle will be our tibial tuberosity. So all of our quad muscles, our common insertion is our tibial tuberosity between our rectus femoris, vastus medialis, lateralis, and intermedialis. All of those muscles are going to produce knee extension. And then one more. What motions are occurring in this right person's leg? Pause video here and try to answer this question. Now you guys should have gotten hip flexion, hip external rotation, and knee flexion. Why? Because this is our figure 4 muscle. Figure 4 muscle is going to be our sartorius. Our sartorius is going to originate from that ASIS, which means you're going to produce hip movements. We're going to get that high knee up, hip flexion. We're also going to get some external rotation, and we're inserting on that medial side of the tibia, which means we're going to pull into knee extension, knee flexion, excuse me. Pull that knee back, knee flexion. Okay. Get into our posterior, sorry about that. Our posterior lateral muscles. As muscles are going to be more on the posterior side and a little bit lateral. So we have our glute muscles, our tensor fasciae latae, our TFL. You guys are going to have to spell out tensor fasciae latae on the exam. So make sure you guys are honing in on your spelling because it is going to count this exam. Counted last exam, but with the muscles, it is definitely going to count. So be very mindful of that. And we're also going to get into our hamstrings. These key notes that you're going to see in these PowerPoints, star them, make sure you guys are understanding them. They are going to help you identify what actions are occurring at these muscles. So if our anterior hip does hip flexion, our posterior hip is going to do hip extension. If our anterior knee is going to do knee extension, our posterior knee muscles are going to do knee flexion. If our medial hip does hip AD deduction, that means our lateral hip is going to do hip AB deduction. We're going to nose. Our glute muscles, we're going to have our gluteus maximus, our gluteus medius, and our gluteus minimus. Gluteus maximus going to be this big muscle there, as you guys can see highlighted. It's going to originate from our ilium, our iliac crest, and our sacrum. Yeah, I can see how that's touching our iliac crest there. It's touching our sacrum here. And then it's also touching our ilium inside. Insertion is going to be at gluteal tuberosity. So just like we had our bony landmark on our humerus for named the deltoid tuberosity, we're going to have a bony landmark on our femur named the gluteal tuberosity, which is going to be the insertion for all of our glute muscles. Now this action is not only going to produce hip extension, see how big that muscle is? Not only is our action going, see its origin here, insertion here. Not only is this muscle going to produce hip extension, we're pulling that leg backwards, hip extension, but between these fibers, you can imagine that this is going to pull like that. So not only are we going to get hip flexion, but when that pulls, you guys are able to see how we're going to get some external rotation. Origin here, insertion there. It's going to pull this way. We're pulling in an oblique fashion. If this was pulling just upward, that's how we would just get hip extension. But because we are pulling in more of an oblique fashion, we're going to get hip extension. And also, this is going, while it pulls this way, our femur is going to turn that way. we're going to get external rotation of our femur. Two muscles are our gluteus maximus, a gluteus medius, and gluteus minimus. These two muscles are going to produce the same actions. It's going to originate from the same spot, and it's going to enter in the same spot. One is just smaller, minimus, than the other. You guys see this is minimus here, and this is medius there. Here's our glute max. So origin for that is going to be our ilium, and then insertion is going to be that greater trochanter of our femur. And then it's going to produce hip abduction because we're on that lateral side of our hip. Medius. Because we're strictly on that lateral side, this is our origin, this is our insertion. When we pull up, we're going to pull our leg outwards into hip abduction away from the midline. Let's see if I can draw a little bit better this angle, origin, insertion, pulling up that way, we're getting abduction. Whereas glute max, because it's more posterior, posterolateral, that's how we're going to get knee extension and external rotation. Our TFL, our tensor fascial latae. This is going to be a muscle that's going to go in with our IT band. So our origin also in that iliac crest. You guys can see we have iliac crest origin, ilium origin for these muscles. So here's our iliac crest here. We're going to originate from there. An insertion is going to be near the lateral tibial condyle via the iliotibial band. This is going to be considered our IT band. Now see how that comes all the way down and inserts near that lateral condyle on that tibia. But here's our tensor fascial latae here. That's a TFL. This is our IT band. So if I have a origin there, let's go here. Tensor fascial latae there. We have that. And then we're going to pull up our iliotibial band. There. So if this is our origin here at the iliac crest, this is our insertion on that lateral side of the of our tibia. When this pulls up, you can imagine we're going to get some hip abduction. At the same time, we are also going to get some internal rotation of the hip because of the way that these fibers are oriented. We're going to get some internal rotation. We have hip abduction and some internal rotation at the TFL. Our hamstrings. We're going to have 3 hamstrings. We're going to have one that's more lateral. If we're looking here, we know that this is medial and this is lateral because these are vertebrae there. So this is more lateral. It means this is going to be our bicep femoris. Put it in a different color. This will be our bicep femoris there. More is a bigger muscle. Now, between semi-membranosus and semi-tendinosus, they are both on that medial side. One is going to have more of a membrane looking, and more is going to have more, you see, membrane. And then more is going to have more of a tendon look, more of a thinner. So we're looking at this picture. If one has more of a thicker band and one has more of a thinner band, which one of these do you think is going to be membranosus? 1 or 2? The correct answer should be number 2, be membranosus. You see how this muscle here comes down into like a membrane. It is thicker, more of a membrane there. And then our tendinosus is going to come into more of a thinner tendon here. So you guys can see how membranosus is a little bit underneath tendinosus. Let's pull up those muscles. We have our biceps. Ooh. Biceps femoris. We have our semi-membranosus, and then our semi-tendinosus. You see our biceps femoris, that thick muscle here on that lateral side, becoming more medial. We see our tendinosus there and our membranosus hiding right underneath. Those are your hamstrings. Bicep femoris. If we're on that posterior side, we're going to have 2 heads. Where just like our biceps brachii, we have 2 heads. Bi equals 2 heads. So we're going to have a long head and a short head. Our long head is going to originate on that ischial tuberosity. Our ischial tuberosity, you guys should know on your coxibone, you have your ischium. You have that ischial tuberosity there. This is your ischial tuberosity. So you see our biceps femoris, long head is going to originate from that ischial tuberosity. And our short head, here's our short head, is not going to get to that hip bone. It's only going to originate from that femur, from that linea aspera. That's how you got long head at the tibial tuberosity and short head at that linea aspera. They are both going to come and insert on that fibular head. So this is, the fibula is on that lateral side, which is how we know that our bicep femoris is on that lateral side. These two are going to come down together here, insert onto that fibular head there. Now, because we are, I'll let you guys try to figure this out yourself. Because we are crossing the hip joint, we're going to have some hip movements. We're on the posterior hip, which means posterior hip muscles do what type of movement? You guys should be saying hip extension. So we have some hip extension, and we also crossing the knee joint, which means we are doing some knee movements. The knee, as a hinge joint, can only do 2 separate movements, our flexion and extension. We are inserting on that fibular head. So when this origins up there, insertion here, when this pulls up, you see how we're going to get some knee flexion. We are bringing our heels to our butt, get some knee flexion. And that's how we're going to get those 2 actions, hip extension and knee flexion. The hip extension is going to come from our long head or our biceps femoris because it's originating from that ischial tuberosity. It's originating from our hip bone. Now, semi-membranosus and semi-tendinosus. Remember, membranosus is going to have a membrane looking, tendinosus more of a tendon. Origin is also going to be on that ischial tuberosity. If we're on the ischial tuberosity, that means we're going to produce some hip movements. We know we're on that posterior side of the hip. Posterior hip muscles do hip extension. insertion is going to be near that medial condyle of the tibia. So we have tendinosis and membranosus here, origin there. Insertion near that lateral. This is excuse me. This is medial. This is lateral. Insertion near that medial condyle. When this pulls up, we are going, because we are crossing that hip joint, we are going to get some hip movements. You know, we said hip extension, but it's also crossing this knee joint and inserting onto that tibia. So when that pulls up, you can imagine when this pulls up, oh, this is insertion, this is origin, you're going to get some knee flexion as well. We're pulling that muscle back. You know, see how this is also inserting on that medial side of the tibia. And that's how we're going to get knee flexion. So membranosus and tendinosis kind of, especially tendinosis, is going to insert the same area that your sartorius and your gracilis inserts on that medial side of the tibia. And we know that those two muscles are going to produce knee flexion, which is why your tendinosis and membranosus also produces knee flexion. Everyone is good with those. Would you guys to take confidence to yourselves and try to label these PowerPoints here. So, your minutes. Okay. The action of this right knee. You see the right knee, we're bringing the heel to the butt. That means we're producing knee flexion. What muscles produce those actions of knee flexion? We have your posterior knee muscles. So some muscles that do that, we're going to have your semitendinosus, producing that knee flexion. You're also going to have some from your sartorius. You have your gracilis, producing that knee flexion. Okay. Now, if you guys go to your packets and try to figure out these on your own. So take a couple minutes, pause the video, take a couple minutes, and try to fill out this graph by yourself using your context clues and some like the cheat sheet things I gave you guys. You know, your posterior hip muscles are going to produce hip extension, anterior hip flexion, anterior knee extension, posterior knee flexion, etc. So take a couple minutes and do that. Come back to the recording when you are done filling this out. Now that you guys are all back, the insertion for iliopsoas, where originate from the vertebral column, producing hip flexion. It's going to insert onto that lesser trochanter. Our sartorius. This is going to be our figure 4 muscle, which means we're going to produce hip flexion. We do some hip external rotation. And we're also going to produce some knee extension. Our quadriceps muscles, they're all going to insert on the same spots. We're going to insert, our quads are on anterior thigh, insert onto that tibial tuberosity. Our actions, our rectus femoris is going to be more on that right in the middle. Rectus femoris will be the only muscle that's going to also cross the hip joint, which means they're going to have some hip movements. We're going to get some hip flexion, but we're also going to get knee extension. And then for the rest of our quad muscles, they are all going to produce knee extension. For muscles of our medial thigh muscles are going to produce adduction. So our adductors, they're all going to insert in a certain spot. They're all going to originate on the pubis, and they're all going to insert onto that linea aspera and produce hip adduction. Our gracilis, another muscle that is going to produce, that's going to insert onto that medial side of the tibia, which means not only are we going to perform hip adduction because it's the adductor muscle, you're also going to perform knee flexion because it has the same insertion for it as a sartorius. And if you have our glute muscles, we're going to have our gluteus maximus that's going to insert onto our gluteal tuberosity. To remove hip extension and external rotation. Now our medius and minimus, they're going to have same origin, same insertion, also the same action. They're going to produce hip abduction. Our tensor fasciae latae, our insertion is going to be origin from the iliac crest. Insertion is going to be near the lateral condyle of the tibia via our IT band. You guys have to know how to spell iliotibial band for the exam. Our action that's going to produce is going to be some hip abduction and some hip internal rotation. And then our hamstrings, we have two heads for the bicep femoris, bi meaning two. We're going to have our long head and short head. Our long head is going to originate onto that ischial tuberosity. Because our hamstrings are going to be on our posterior thigh. Bicep femoris, they're both going to insert at the same spot. They're both going to insert at the head of the fibula. Our semimembranosus is going to originate from different spot than our bicep femoris, just because we have the two heads. Semimembranosus and tendinosus, they both would originate from our ischial tuberosity, though. And then all of our hamstring muscles will produce the same action. We are going to get some hip extension because it is going to be a posterior muscle, hip extension. And because we are crossing the knee joint, we're also going to get knee flexion. Hope everybody is good with those muscles of the hip and thigh, muscles of hip and thigh medially, anteriorly, and posterolaterally. Now, I encourage you guys to fill this out on your own. At the end, I will double back and go over and label it. So pause the video here and see if you guys can label these muscles on the model. Excuse me. And we have muscles of the lower leg. We have posterior, anterior, and lateral muscles. Posterior, we're going to have our superficial and our deep. Superficial is going to be more on the surface. Deep is going to be more inward. Our posterior muscles. going to be your gastrocnemius for your calf muscles. They're going to originate near the femoral condyle. So you see here how here's the femoral condyles there. They're going to originate near those two condyles. You're going to have two heads. As you can see, you have one head here, another head there. Insertion is going to be on that calcaneus. Remember, calcaneus is going to be your heel bone, but it's going to insert that via our Achilles tendon. Here's our Achilles tendon here. And the action, because we are now crossing this joint here, our ankle joint. That means we're going to have some ankle movements. If we're on the posterior side, we're going to get plantar flexion. So posterior, we're looking at posterior lower leg muscles. We're going to get posterior lower leg. We're going to get plantar flexion. That's we have your Achilles tendon. So you guys can see how if this is the origin up there, this insertion, when that pulls up, your foot is going to come down. You're going to push onto the gas pedal. We're going to get plantar flexion. Our soleus is going to be another posterior lower leg muscle. So we got posterior lower leg. That's going to be found underneath our gastroc. So you're going to have to pull the gastroc back. As you can see in this picture here, we have removed the medial head of the gastroc. So you can see the soleus. Soleus kind of looks like a fish. I was like, put a little mouth there. There's your fish. Soleus fish. So, origin is going to be in that posterior tibia and fibula. You guys can see here, it's going to kind of originate there. Insertion, same insertion as your gastroc, your calcaneus via your Achilles tendon. And then it's also going to produce plantar flexion because we're on that posterior lower leg. Like I said, posterior lower leg is going to produce plantar flexion. So they're going to be our superficial muscles. Superficial. Here, we're going to have your gastrocnemius and our soleus. Your two superficial muscles. Our deep ones, we're going to have our deep plantar flexors. These are still on the posterior side, which is why we're still they're still going to have the action of doing plantar flexion. We have your tibialis posterior, your flexor digitorum longus, and your flexor hallucis longus. Digitorum, you guys know that means digits. The word hallucis is going to mean your big toe. So flexor hallucis longus, you know, it's going to flex your big toe. And it's going to be a long muscle. Start with tibialis posterior. It's going to be originated from your posterior tibia. Insertion is going to be in that plantar surface of the foot. So you guys can see how this is coming from posterior side, coming all the way down and inserting underneath your foot. It's going to insert underneath that first metacarpal. And that's how when you pull it up here. tibialis posterior. That's why when origin, insertion underneath. When this pulls up to its more stable origin, that's how we're going to get plantar flexion. But because we are also on that medial side, you see how when this pulls, we're going to get downward motion, but we're also going to get some sideward motion. So just like when we had our flexor carpi radialis that did flexion of the wrist and radial deviation, our tibialis posterior, because it's inserting on that medial side of our big toe, is going to not only pull our foot down onto the gas pedal, but it's also going to pull our foot into inversion. And that's how we're going to get plantar flexion and inversion there. This is going to pull down. It's also going to pull outward. Our flexor digitorum longus is going to originate near the lateral condyle of the tibia. Insert on a surface, the plantar surface of digits 2 through 5. Remember, digitorum meaning digits. It's going to be a digits 2 through 5. Just the same thing with our flexor digitorum superficialis. It inserted it on digits 2 through 5. But this is going to be your plantar surface. This is going to get flexion of the digits. Flexor digitorum, flexion of the digits. Your flexor hallucis longus. It's going to flex your big toe. Flexion of the hallucis, flexion of the big toe. It's going to originate from that fibula. So it's going to originate on that lateral side and still going to come around. Even though it starts from the lateral side, it's going to come all the way around to that medial side to insert onto that medial big toe on that plantar surface. Insertion is going to be plantar surface of the first digit. So those are our deep muscles. Come back up here. Deep muscles, we're going to have tibialis posterior, our flexor digitorum longus, and then our flexor hallucis longus. Make sure you guys are honing in on your spelling. Do not forget spelling. On the anterior side, if our posterior lower leg muscles did plantar flexion, that means our anterior lower leg muscles are going to do dorsiflexion. Origin near that lateral condyle of the tibia. Insertion is going to be in that dorsal surface. So anything that is anterior is going to provide dorsiflexion, which is why it's going to insert dorsal side. Anything plantar flexion is going to insert plantar side. So you see here, we have an origin there, insertion here. If we pull up to our origin, you see how we're on the anterior side, it's going to pull our foot up off the gas pedal. We're going to go into dorsiflexion. But because we are inserting onto that medial side, our big toe, we are also going to get some inversion as well. So we're going to get dorsiflexion and inversion. Whereas tibialis posterior is going to do plantar flexion and inversion, or tibialis anterior is going to do dorsiflexion and inversion. Central digitorum longus, just like we have flexor digitorum longus, we're going to extend the digits. Central digitorum longus, extend digits 2 through 5. So central digitorum longus, just like we have flexor digitorum longus that flex the digits of 2 through 5, we have the opposite, central digitorum longus, that extends digits 2 through 5. Insertion in dorsal surface of the digits. Your extensor hallucis is longest. Just like we had flexor hallucis is longest, we're going to have the opposite. Extensor hallucis is longest is going to be extension of the hallux, extension of your big toe. Origin is going to be in that fibula instead of that lateral condyle. And then still going to insert on that dorsal surface of the first digit. So on the posterior side, we have your tibialis posterior there. If you follow the tendon here, you're going to get into flexor digitorum, digits 2 through 5. And you're also going to have your flexor hallucis, follow the tendon into your big toe. The one thing here is that your tibialis posterior is going to be in the middle. Your flexor hallucis longus is going to come from that lateral side, while your flexor digitorum longus is going to come from that medial side. This is going to be on that lateral side now. Fibularis longus and brevis is going to be on the lateral side because our fibula is on that lateral side. So origin is going to be in the fibula. Insertion is on that plantar surface of the foot. I come here. Lateral lower leg. We have our fibularis longus. That is longest compared to our brevis being shorter. Longest is going to come all the way from that condyle up there. But you see it's going to wrap all the way underneath and still get to that big toe. It's still going to come medially. So it's going to come laterally to come medially. So at the origin there, insertion there. When this pulls upwards, not only are we going to get some plantar flexion, we're going to push on that gas pedal, but because we're coming from the lateral side, inserting on that medial side, when it pulls, it's going to pull into eversion. Our ankle is going to pull into eversion. And that's how we're going to get plantar flexion and eversion. We're going to pull down and out. Now I want you guys to pause the video here. That's me in the corner again. Pause the video there. See if you guys can fill out this chart by yourselves. Okay, then we have our gastroc. So our gastroc and our soleus, they're both going to have the same common insertion. Insert on your calcaneus from your Achilles tendon. So the Achilles tendon. That's going to be the same for both. Action of your tibialis posterior. Posterior lower leg muscles are going to do plantar flexion. We know that. But because we are inserting onto that medial side, we are also going to get some inversion. Flexor digitorum longus is going to flex your digits 2 through 5. Flexor hallucis longus is going to insert onto that plantar surface of your big toe. Of your first digit. And that's also going to flex your first digit. Flex your hallux. Instead of saying first digit, I want you guys to say flex your hallux. Tibialis anterior. Anterior lower leg muscles are going to reduce dorsiflexion. Because we're going to that medial side, we're also going to get some inversion. Your extensor digitorum longus is going to extend your digits. And your extensor hallucis longus is going to extend your hallux, your big toe. On the lateral side, your actions for your lateral muscles, they're going to pull into eversion, but also going to pull into plantar flexion. Pause video here so you guys can fill these out and label your muscles. And at the back, we have one for your gastroc, there and there, and here. Number 2, our soleus is going to be deep. Going to find that there on your models. 3 are tibialis posterior. Remember, we're on the posterior side, so over here. 3 is going to be this muscle there. Number 3 will be this muscle here, right in the middle. Our flexor digitorum longus is going to be on that more on that medial side. That is going to be number 4 there. And then our flexor hallucis longus is going to be on that lateral side. Will be number 5 there. Tibialis anterior. On the anterior side, number 6. Tibialis anterior is going to do dorsiflexion and inversion. This right here. Will be number 6. There and there. We have your extensor digitorum longus. We'll see your digits, number 7. You see how those tendons are coming off of that. See your digits. Number 8, you have your extensor hallucis longus. That's going to be underneath. Kind of hard to show you guys in here in this picture. There. Number 9, our fibularis longus and brevis. Longus will be 9, brevis 10 will be underneath. This will be brevis there. Coming back up here for our iliopsoas, number 1, we're going to have number 1 here. Our sartorius, remember, that's our figure 4 muscle. You're going to find that here and here. For the views first, I'm going to say this is anterior view, this is going to be your posterior view, this is going to be your medial view, and this will be your lateral view. 1, 2, your rectus femoris, that's your quad muscle. We're going to be in the anterior view in the middle. Here's 3, rectus femoris, and then your vastus lateralis and medialis on the sides. This is medialis over here because that sartorius goes to that medial side of the tibia, which means that it's medialis, and this is lateralis. Number 4. 6, adductor longus. We're going to be on that medial side. Let's do it 8 first. So gracilis 8 is going to be that part right there. 6, your longest is going to be here. And then 7, you're going to find here and peeking out there as well. Magnus, you can find more on that posterior side there, as this is the gracilis here too. Gluteus maximus, there's 9. Your tensor fasciae latae, 10. goes into iliotibial band on that lateral side, 11. 12, biceps femoris, we're on the posterior aspect. We're talking about our hamstrings. Posterior femoris is going to be in that lateral side. That's going to be number 12 there. And then we have number 13, membranosus and tendinosus. 14 is going to be on top, tendinosus, and then 15, membranosus will be kind of around there. Did that wrong. Membranosus is 13. And then 15, glute med will be there. Now we did that. Now to go back to our Lab 5 packet and fill out these muscles. Our biceps brachii. This is going to be the posterior side. It's going to be the anterior. Biceps brachii will be number 1 there. Triceps brachii, number 2. You have 3 heads. Coracobrachialis, number 3. Brachioradialis, going to be underneath biceps brachii, so that'll be 4 there. Excuse me. Brachialis is under brachioradialis is number 4 here. Number 5, your pronator teres. Remember, we have your pass, fail, pass, fail. Pronator teres, 5. Palmaris longus, number 6. And pass, fail, pass, 6. Flexor carpi radialis, number 7. Will be there. And flexor carpi ulnaris will be number 8 here. Number 9, flexor digitorum superficialis. Number 10, you have your extensor carpi radialis longus. We're on that posterior side. Radialis, we're going to that radial side. We're going to have number 10 here. And then number 11, brevis, will be right there. 12, your extensor carpi ulnaris. Going to that ulnar side. You have here. And then 13, your extensor digitorum will be there. So that will be it for lab. That'll be it for lab 6 and 7. So we have concluded going over our upper extremity muscles and our lower extremity muscles. If you guys have any questions, please do not hesitate to reach out to me. Set up office hours to meet with me. We can go over muscles, go over using the models as well. So if you guys don't have any other questions, hope you guys have a great wellness day. Take some time to relax. And then I will see you guys next week. Don't forget your Lab 7 pre-lab reading and quiz will be due on Monday, October 20th. So please get that in on time. Do not forget it. And other than that, have a great weekend, you guys. Thank you for watching.